We're super excited to have Dr. Mark Hyman. Thank you so much if you're watching at home. Really excited for you to be here and to be part of this. We've had an incredible day here in Cleveland. We've had the opportunity to check out and tour around the Cleveland Clinic Center for Functional Medicine. Nothing that I say today is discongruent with what I saw this afternoon. It was amazing to see the power of community and the power of health coaching and the power of functional medicine being fused together. And ultimately what we're going to talk about tonight is a way for expanding the opportunity for most people in America to have an opportunity with this infrastructure. So thank you Designs for Health. They sponsored this evening, and we really appreciate their support. If you're a practitioner who is doing functional medicine, definitely check out Designs for Health. You can win a prize pack, lots of other great things there. Just a family-owned company that is in this business for the right reasons and super supportive. So, if you've ever got an email from me in the last 4 years, direct email from me, you've seen this quote on the bottom of my email. And I would say up until 4 years ago, I would say I was kind of like maybe 4 or 5 years ago, I was like a sort of a activist, I guess. I was angry about a lot of things. I was angry about the medical system. I was annoyed the way that it's set up. I was annoyed that there were like seemingly insurmountable roadblocks to getting us to, as Charles Eisenstein said earlier there, like the more beautiful medical system that we all sort of intuit is possible, but we're just not like connected to in any way at this moment. It doesn't exist right now on the planet. And then I saw this. A friend of mine said it to me from Bucky Fuller. He says, "You never change things by fighting the existing reality. To change something, build the new model that makes the existing model obsolete," right? Could it be any more obvious that this is exactly what we need to do in chronic disease management, right? If you can, a patient cannot reverse their type 2 diabetes on metformin. It's just not designed to do that, right? It doesn't do that. There's no chance of it happening. Whereas a patient can reverse their type 2 diabetes with functional medicine, with taking action, with being, involved with being empowered. And so, talk about making the existing system obsolete. Like, how many kidney dialysis centers do we really need? Like, how many of these things, how many bariatric surgeries do we really need? Like, we could make all of that obsolete if we just went upstream and put this kind of care at the beginning. So I've been like obsessed with this quote for that long. And what you're going to hear tonight is essentially, sort of like a strategic plan to build that new model, right? And it's called new with a K because when you say it, it's just like, hey, everyone knows what the word new means. N-E-W is like, this is just a new way that things get done. I'm sick of alternative. That's a ridiculous word. It doesn't describe what we're talking about at all. Even functional, we tried to build communities, or we have built communities of practitioners around the word functional for the last 5 years. Some people don't want to be functional. They're like, I'm not functional, I'm integrative, or I'm holistic, or whatever. It's annoying that we can't have like the word that everyone can use and we feel good about it. So I'm just like, yeah, it's new. This is clearly the way. Mark said about 10 minutes ago, speaking to someone at the back, in 10 years, this will just be the way it's done. And everyone will be like, so crazy that we did it the other way, right? And so it's called new because when you say it, it comes with an authority like this is just the new way that things are going to get done. But it's got a K at the beginning because we don't have access to the kind of health that even 2 generations had ago in this country, but certainly not the ancient wisdom. Like, look at the blue zones, right? The places in the world that have the healthiest people that live to 100 without chronic disease. Do they have the Cleveland Clinic Center for Functional Medicine up the way? Hell no, they don't. They got no medical systems in some ways. They just have community and support and do healthy behaviors is baked into the culture, right? So what's it going to do to create a culture in America of health and create the right services at the right time? So as we go through this new vision for healthcare, I want you to keep in mind 2 things, right? How do we keep everyone healthy? Right, everyone performing up to their maximum. So much in America is lost by people who are sick, unnecessary suffering, right? We want to deliver on the human potential. We want to keep everyone well, and we want to think about the minimum possible cost, right? Because we're already at almost 20% of GDP. I said earlier, you can take whatever facts you want to talk about where we're headed, but if it's 40% of GDP or 80% of GDP or whatever it's projected to be, like, the economy collapses way before that day ever happens. Like, we literally become like serfdom. It's like Russia 1998 all over again before that happens. I want to try and avoid that. I think most of you in this room want to try and avoid that. And I think what we're going to talk about tonight is a reasonable plan to get there. So, what is this new vision for healthcare? It's very easy because I came up with all of them, start with the letter C. So it's very easy to do it. When Mark actually came to the Functional Forum in May 2014, he kind of helped make the Functional Forum cool by announcing this Cleveland Clinic project before anyone else in the space really knew about it. And that night, I think you had 4 C's, Mark, so I've outdone you by 5 C's, but we'll see if any of them match up. So the first thing is culture. We're going to talk about how to create a healthy culture. How do we facilitate a healthy culture? What does it take? You can't change the whole culture of America overnight, but what you can do is to create a cool, aspirational culture that people want to be part of. And guess what comes along with that cool, aspirational culture? Healthcare costs at a fraction of what everyone else pays. Now it's super cool. Now it's super cool because everyone else is like, hey, look how much money everyone's wasting on this other stuff. I'm smart and I'm saving money and I've got all this extra money because I'm doing it. So healthy culture. And I just want to say, as you look at this, right, we're following a concept that comes from naturopathic medicine called the therapeutic order. And the therapeutic order basically postulates that you should use the lowest cost, least invasive modalities first, and then move up towards the most expensive modalities. So don't start with drugs and surgery, basically. Start with like mindset and running and eating differently and maybe supplements, but not drugs, especially not Humira that cost $5,000 a month, right? Okay, so what you'll see with all these things, we're going to start cheap and then we're going to get slightly more expensive as we go away. So first is culture. Basically costs nothing. Read Dr. Mark Hyman's book, any one of those 12 books, start implementing it and you're going to get really healthy. He's created a culture of that kind of thing. The next is community. Right? Community, again, doesn't cost that much. Getting a group of people who have the same disease in a room together, providing some content for them and doing essentially a group visit. I saw it at Cleveland Clinic today. It's totally epic. It's definitely the future, and it costs not very much because you've got 8 to 12 to 16 people splitting the cost of like one provider. It's so efficient. The power of peer-to-peer medicine is crazy, and we're going to talk about that tonight. Community is the strongest factor in health cost reduction, in health creation, and we're going to talk about that later. The third is coaching, right? So it's incrementally more expensive. Now we're at coaching. We haven't got a doctor, right? No doctors have been seen yet, right? This is the 5 C's of a new vision for healthcare. We have not reached the doctors yet. Why? One, there's just not enough functional doctors to go around. We're still dealing with that issue, right? Until we have a huge humility party in the medical profession. Everyone realizes, you were wrong, we shouldn't be doing that. It's unlikely, but it's happening. So coaching, we'll talk about this. I said it earlier, we need behavior change, right? We need behavior change. We're going to deal with the 86% of costs that are driven by lifestyle. We need to change the lifestyle, and coaching is a lower cost option than the next layer is care, functional medicine care. If you have a chronic disease and being part of a new culture of healthy behaviors, being involved in a new healthy community and having a health coach keep you activated is not enough to get you healthy because you've got some sort of weird thing happening, you're not sure exactly what's going on, it's not clear, the blood labs aren't showing you what to do. Do the functional medicine, right? But don't do it at the beginning. We can't afford to give everyone a GI, test from, we can't give everyone, you don't save money by giving everyone a $2,000, functional medicine test, right? But if the other option at this point is a lifetime dependence on medication, then it's probably a good time to do some root cause resolution work, right? So that's the 4th C. And then the 5th C is cost sharing. And that's what we're going to get to at the beginning, in the middle, for the most expensive, unlikely things, like a car accident or an infection or cancer. What are you going to do? Functional medicine and cancer haven't been best friends so far because cancer is kind of unpredictable, right? Many other chronic diseases are predictable in their etiology, predictable in their progress. Cancer is just another animal. It's a beast, but what are you going to do if you get it? You need some sort of way of protecting the downside risk. That's what health insurance is kind of for. But we're going to talk about health cost sharing. So these are the 5 C's. This is the story that we're going to tell tonight. And we you make your own luck. We have very thankfully, people who are doing this at the highest possible level in Cleveland right now, and you're going to hear from them. So the first one is culture. I'm super excited to welcome our guests. You know, Mark and I have been friends for a few years. You know, in a few years when we tell the story, there's been a number of things that have happened in our relationship. I started out as Mark's chauffeur. I picked him up from LaGuardia in his car. That was the only way that I could get 45 minutes to pitch him on coming on the Functional Forum. It worked. And since then, we've had an opportunity to share so many great moments. And, you know, I'm sort of like, you know, we become friends, and I'm really, really thankful for him setting up the opportunity in Cleveland Clinic today. I look at him as one of the most transformational leaders. And, you know, one of the reasons why I wanted to come and have him talk about culture tonight is that Mark is going beyond functional medicine through his Doctor's Pharmacy podcast, and like he gave an address at about Martin Luther King recently that like had my wife and I sort of like crying at home about how poignant and how right it was. So to talk about what it takes to build a healthy culture, how to make health cool, please welcome to the stage the director of the Cleveland Clinic Center for Functional Medicine, Dr. Mark Hyman.
Cleveland on Wednesday night. I'm thrilled to be here. I've come to really love Cleveland. I've come to really treasure my time here and treasure what we're doing at Cleveland Clinic, because it's really extraordinary, it's unique, and I think it's a catalyst for change throughout the whole movement. So I'm really grateful, and I know there's a lot of our colleagues here. We have Carolyn Wright, we have something like intervention from me in person. We've got Bridget, who used to be with us, Paris, who else? Whoever else is here, I've mentioned, I'm sorry, but there's a lot of us here because they care, they show up, they work all day, and they still come out. Oh, Nate, there's Nate, I'm not forgetting you, Ariana, and Brian, and all right, good. I want to talk about something that I've been thinking a lot about over the last decade, which is something that often is ignored in medicine, and yet is the most important thing we need to consider when we're trying to reinvent and create a healthy culture. And I first sort of started thinking about this in 2010 after I read a book called Mountains Beyond Mountains about Paul Farmer, who figured out how to cure TB and AIDS in the worst places in the world, like in Haiti, which is the second poorest country in the world, the worst in the Western Hemisphere, where half the people live on less than $1 a day. 80% don't have clean water to drink. And he figured out that the answer to curing those diseases was not better drugs or surgery, was actually helping people help each other. He called it accompaniment. We need to accompany each other to health. And I began to think about this a lot, and I realized, when you look at the data of what is driving disease, I've been studying functional medicine for almost 30 years, looking at biochemistry, physiology, genetics, and all the biological networks and the molecular pathways, and that was fascinating to me, and I use it to help people get better one-on-one in remarkable ways. Just really remarkable stories of recovery and healing that we just don't see in conventional medicine. And then I realized, I was sort of in the weeds, and the most important thing that it really is driving chronic disease is our social and cultural environment. So that's the biggest thing, and we're ignoring it in medicine. We just work within the walls. We work within our clinics and hospitals, in our doctor's offices, in our little cubicles, and we don't look around us and say, why is it people are here? How do we change the social context of what's happening? And it turns out that your zip code is more important than your genetic code when it comes to your health. There have been studies on this where they take people from a low socioeconomic area, they put them in a little bit better socioeconomic area, and their diabetes gets better and they lose weight without any medical intervention, just changing the environment and the context of what people live in. And I began to realize that we're focusing in some ways a little bit downstream. When we're trying to do functional medicine, we're dealing with people who are sick from chronic disease. And people who are sick from chronic disease are generally sick because of what they're eating. So we try to change what they're eating. But the problem is the food system is providing food